Facebook Live and turn on the radio all in the same house. You know what I mean? Depending what room to room you go in. So we appreciate that support. It's 822, the January 26th episode of The Link 2021. Dr. Peter Lombard crunching COVID stats. He's been with us since the first wave, and we really appreciate and value his insight in kind of crunching a lot of this data and putting it in terms that hopefully we can all understand. So good morning, Dr. Lombard.
Good morning, Chris. Good morning, Sabrina and Jason.
Morning, Doc.
What are you looking at this morning?
Well, I didn't know I had to come on before 8 to get some screen time on TV, so maybe next time I'll ask for an earlier slot.
Yeah, hey, I just thought you didn't like waking up early anymore. Let me know.
Yeah, well, lucky we live in Guam. I think if you guys have the slides up, you can see, just it's been, I think, 2 to 3 weeks since I was on last, but we continue to lead the nation in terms of the fewest cases per day that we're seeing. Hawaii's down here with us too, and they had a little spike a couple weeks ago, but I was worried that was going to turn into a big surge for them. But they're still doing okay. I still don't know where Hawaii is going. They still have numbers in the in the hundreds per day, kind of bouncing up and down. So I think if that variant gets there, they're going to be in trouble. But if they can vaccinate fast enough, they'll be able to pull this off, which is really a great thing for Hawaii. As you can see, most of the states, they're coming down now from the surge that they saw a couple weeks ago. Could this be a little bit of an effect of just more of the population having had the infection? Is it effective mitigation efforts, early effective vaccinations, possibly? But I think the big question is still how much. We know that the new mutation is in the U.S. and how much is that going to affect the possibility of future surges? But we're still seeing 3,500 deaths per day. That's one thing that hasn't started decreasing. The cases have decreased, but the deaths are still very, very high. We had 3,000 people die in the World Trade Center terrorist plane crash, and we're having that happen over more deaths every single day. And that stat is just bewildering to me. And worldwide, we're looking at 2 million deaths, well over 2 million deaths now. So mobility, I think it was interesting to see. We touched baseline here. I think this correlated with schools opening and the change in the P Corps status in businesses, but still we're still not jumping back up to the baseline we saw at the end of the summer when we had the beginnings of our first surge. Big thing I'm tracking is the vaccinations now. I think the case data isn't quite as interesting in Guam, although it is interesting that our numbers have not come down to the levels that they were back in the summertime when they were down in the 1 and 2 cases per day. But as of last night, we've got over 15,000 at least 1 dose vaccinations in. That's over about a 6-week time period, if I have my dates right. And so we're pretty much 2 times the number of actual diagnosed cases, which is very good. A lot of other states aren't anywhere near that. And that correlates to about 9%. Getting close to that 10% mark of the population of Guam vaccinated. At this rate, it would take us about 3 months to get to 30%. And looking at the number of vaccinations we're doing today, I think we're looking at, it seems like they're doing between 500 and 1,000 per day, depending on how many sites are open. I think it was on the JIC report last night. They were showing they could do something like 450 cases at UOG plus walk-in. So, and then they've got these other sites where they're working on the school, the educators as well. So, 500 to 1,000 vaccinations a day. And that's not great, but it's 3 months till we get to just 30%. And that's important because there's someone I follow who does some analysis about how soon the U.S. is going to take to get to herd immunity. And looking at this chart down here, you'll see the purple is the folks that have had infections, and the blue is the folks that have had vaccinations. So if you combine the two, you'll get to this herd immunity about 75% by midsummer. Now that's a combination of natural with vaccination immunity. If you want to wait till we get to full vaccination immunity at 75%, of course that's going to take a lot longer. But the closer we get to this mark, of course, I think the easier it is going to be to control outbreaks. what I'm seeing in our data, age data, I was able to finally look at some of the age breakdowns for the past few weeks, and the number of cases over 60-year-old, we'd like to see those decreasing at some point because that's who we're targeting with vaccinations, but we've still stable at about 10% of all of our cases are over 60. But there is very encouraging news out of Israel, which is leading the world in vaccinations. They've about 25% of their population has been vaccinated. What they're saying is 3 weeks after their first shot, a 60% decrease in the hospitalizations for those over 60 years old, which is just awesome. So that's good news. And I think, all other countries are going to see the same sort of improvements. We have 22 million doses administered in the US. Of course, all of them are the mRNA vaccines, Pfizer and Moderna. And there's a lot of folks scrutinizing the safety data as they should. And so far, it looks like it is a safe vaccine. So here's the age breakdown. Just the orange here is all the cases below 60, and the blue is over 60. There were a few weeks where they didn't give good age data, so that kind of is just averaged out here. But the last 2 weeks, this is reliable from the JIC data. So 9 out of 75 cases and 7 out of 73 cases the prior week. So it's about 10% over 60. So I'd like to see, even if the numbers stay where they are overall, 60 to 70 cases a week, it'd be nice to see the percentage of those cases over 60 decrease. And, in Guam, we have about, at least in most recent years, about 900 people die every year. And that turns out to be, 2 to 3 deaths per day on average. So we know people are just gonna die of natural causes. So, and I've talked about this before, and I think it's worthwhile to mention again. I showed a slide where I said if we vaccinate 100,000 people over 2 months, how many of them do we expect to die? How many of them are going to have a heart attack just with normal human outcomes? And if we break that down to 10,000, because that's where we are, we're a little bit better than that with vaccinations. But 10,000 people, if you just take a random sample of 10,000 people and you follow them for 2 months, 4 of them should have a heart attack, 4 of them should have a stroke. 1 will have a cancer diagnosis, and 14 of them will die. And those are just taking averages of populations. And so, if those 10,000 were in the vaccinated group, plus when we're talking about vaccinating people that are elderly, we might even see more than that. But it's important, as you see news reports of folks that die at some point after getting a vaccination, you also have to say, well, what is it happening at a higher rate among the vaccinated, or is it just the normal rate that we would expect anyways for a population? And that's what the folks that are looking at the safety data are really scrutinizing. And it's disheartening to hear people just say, well, we're not really looking at the safety with a careful analysis because we're trying to just push the vaccination on people in a way that's going to be dangerous. That is absolutely not the case. We have extremely smart people looking at these data to make sure that the vaccine is safe and it's not causing any type of outcome that would not already be expected for the numbers of folks that are being vaccinated. And I hope I can get that message across appropriately. This is sort of the big picture of what we've seen since the beginning last year in March. We're coming close to the 1-year mark, and the beautiful thing here is the red. Our hospitalizations have decreased. We've been sort of plateauing about 10 hospitalizations and 2 to 3 ICU. And if we just zoom in on the last 2 months on this slide here, you can see in early December we were still at about 45 hospitalizations, and we've sort of bounced up and down around the 10 hospitalizations. And here's that little grouping of deaths that we saw a week and a half ago, 4, and it seemed like it was a lot. But that's just, I think, normal variation. And what you're going to see, we're averaging about 2 deaths per day over the last 2 months. I'm sorry, 2 deaths per week over the last 2 months. And it's just kind of been a steady 2 deaths per week on average. And that's probably what 1 to 2, I'm showing about 1 to 2 deaths per week based on the numbers that we have. And and interestingly, if you look at the folks that have the demographics of the folks that have passed the past couple weeks, they're actually in a little bit of the younger age group, which correlates with what we saw with the public health report when they showed us all the mortality data. We're a little bit skewed on the younger side compared to elsewhere. But my big question is, well, why can't we do better than this? Why aren't our numbers? Why do we still have 10 cases per day? Why can't we get down to the 1 or 2 cases per day like we had in the summer, or 0 cases? I mean, we're doing a lot of things right. A lot of the population has already had the actual infection. A number of us are getting vaccinated. So I'm scratching my head on that one a little bit. It seems like we should be doing better.
What do you think it is?
If we had a better...
Go ahead.
Well, I honestly, I truly believe if we could devote more resources to contact tracing, we should be able to get to 0 COVID. I mean, look at New Zealand, a number of other, neighbors, which are essentially 0 COVID. I don't think there's any reason why Guam could not have done that if we had the resources. I think we didn't have the resources for contact tracing. And,
right.
Do we spend a lot of our resources now to try to boost that up to protect us against the next surge? I'm really not sure that's the right answer right now. I mean, I think we have a lot of resources tied up with the vaccination effort right now, and I think that's the right call.
Yeah.
I mean, I think we just got to vaccinate as many people as possible.
I mean, Doc, I feel like we just had the news that the CPS, there was a state of emergency declared, and then part of what led to that was using staff to just kind of respond to COVID. And I mean, there was other things involved too, but I wanted to ask, so you're right, now that it's all about the vaccinations. We get calls from people wondering, hey, when are they going to do the next community outreach testing? So that being said, are you worried at all that, I mean, I don't know, I get the impression that our contact tracing, we kind of pulled up our tents and went home on that, and everything's just focused on the vaccine. So how important is, A, community outreach testing and having it more frequently, and B, like you said, standing up contact tracing so that we can find out where these cases are coming from?
Yeah, well, I think they're still doing a fair amount of testing. If you look at the numbers, our test positivity rate is I think perfectly adequate. If you want to keep that in the 1 to 2% range, but if our cases go up to 30 to 40 a day, then the number of tests we're doing is very inadequate, and the number of contact traces we have is inadequate. So it all depends on what happens with our numbers. I mean, right now, if you could easily make the argument, well, our hospital systems are not being overtaxed, so let's just keep the status quo for now and focus on getting people vaccinated. And I think that's okay. Yeah. What are the chances that we have another spike where, again, now we're going to be perhaps even in more trouble because we have all these resources vaccinating and we don't have as many bodies necessarily to ramp up our testing and our contact tracing protocols. Now, one of the things that I think the new administration is looking at are these rapid at-home tests. And that could really kind of be a game changer to help prevent rapid surges. So that's a big unknown. And whether or not this mutation gets here, a lot of that depends on how well we continue to do the travel quarantine and if the pre-test requirement for a negative test is how well that is implemented. I think there's a good chance we'll be able to prevent the one of these new mutations to come to Guam that have this increased transmissibility. Our mobility is what it is. I don't see it really increasing a whole lot if the current guidelines for businesses and schools remain where they are. So I don't see that having a big effect on our future spikes. Big game changers if the mutation gets to Guam, because that can really change things. But if we can keep things where they are, I feel pretty optimistic about the next 1 to 2 months. And regardless, I think, if our most vulnerable population is the elderly, the fact that we've got a big chunk of them vaccinated, I think speaks well to, even if we do have a future spike, I don't think we're going to have the same number of deaths that we had during our previous big surge.
Hope so, Doc. In closing, anything? You got any other charts?
One more quick thing, since this is more up my alley. This was a recent study that came out. So, they're looking at nearsightedness or myopia, and we know it progresses as you get older. So even if you so this is a little confusing, but I'll try to break it down for you quickly. This looks over the years 2015 to 2020, as you go from age 6 to age 7 to age 8. This number here represents how nearsighted you are. The more negative it is, the more nearsighted you are. So you can see in previous years, or as you age, you're going from maybe 0.2 down to closer to 0, and then you get into the negative. So that's just a sort of a normal progression of nearsightedness as you age. But what's interesting, in 2020, we're showing in boys and girls, 2020, there was a huge jump in the amount of nearsightedness. And this is a study that was conducted in China, by the way. So, it may not be applicable to everywhere, but this is at least the theory is with the lockdown efforts and kids spending more time indoors looking at screens. We do know that there is a basis for doing a lot of stuff up close to your face with either books or iPads or phones.
Books.
That does it does actually promote the progression of nearsightedness. So I think this is the kind of data that I'd like to see more of when we have to think about what are some of the side effects of the pandemic that we need to be looking at as sort of corollary costs that might affect us. So I think that it is important for parents to know that this is a possibility. If your kids are spending a lot more time on their screens at home, there may be a little bit more progression towards myopia. I don't want parents to panic, but if your kid is already nearsighted, I think that making sure that you limit their screen time, allow them to spend time outdoors where they're looking off in the distance, they're wearing their corrective lenses, contact glasses. And interestingly, this effect that we see up to age 8 started to taper off by age 9 and 10. So it's not as much of an issue in older ages. This is a very critical age for the brain and the vision development. So I just wanted to put that one plug in since it's a little bit more up my alley and
right on.
Maybe of interest to some of the parents out there. So thank you.
God, I'm going to sound like an idiot here, but Doc, nearsighted, farsighted, because I always forget. Nearsighted, is that when you can see near or you can't see near?
Yeah, nearsighted is your near vision's much better, and you usually need to wear glasses to see well in the distance. That's nearsighted.
Thank you. Sabrina asked that. So the nearsighted, you can see in the farsighted. Okay, I got it. I got you. Near is you can see near.
Yeah.
Far is
you can't see far.
You can see far. Yeah.
You can see far.
I got the. I'm farsighted.
I'm nearsighted.
Yeah. So if something is like, it's weird. I can read it like if it's right here, and then as it starts to go over here, it's a little fuzzy, and then but it's cool because I know an eye doctor who comes on the show pretty frequently. Thank you, Doc.
Well,
Yeah.
Go ahead.
Doc, real quick, I know we had your
one of those virtual eye tests.
Right. Yeah.
Oh,
I
that'd be cool.
I trust an eye doctor who wears glasses. By the way.
Well, Doc, we had a colleague of yours, Dr. Cabrera, was on yesterday, and I don't know if you caught this, but he said that 82% of people that are in the 75 and older demographic now, and there are roughly about 6,000 of those in his estimation on Guam, have now been vaccinated.
Wow, that's fantastic.
Yeah,
news.
he
No, I hadn't
actually
heard
had to
that.
run the numbers 3 times when he was on with us, and he even said he was blown away. He was not expecting it to be that high.
That's amazing. Yeah, I was a little disheartened last week. I had a patient elderly, who just he didn't believe that COVID deaths are real. I mean, I don't try to get into it too much with the patients, and I can tell if they sort of are in this denial about it. But he said he gets together with his group of friends every single night. They have a few drinks and smoke a few joints, and he said we're all fine. And so he didn't understand. He thinks that the deaths are coming, either they're flu that's misdiagnosed or something else. And I said, well, what else could they be? And I told him in 2020 we had about 250 more deaths than we should have had. 250, and we only know of 130 COVID deaths. So what are those deaths? And he couldn't give me an answer really. But it was just really amazing to see how people's perceptions of what's going on out there can be very, very much skewed in a way that I just can't understand.
It's crazy when you reach a point where you kind of like, God, why am I even arguing with this person? They're too far gone down the other side.
Yeah.
All right, Doc. Thank you.
Thanks, guys.
Okay.
Right. Have a good day, Pete. I was wondering that I would probably, if I was going to do analysis, like, hopefully there would be even
First of all, I just want to break in and say having a few drinks and smoking a few joints a night does not prevent you from